2, 3, 4, we need a health accord. 1, 2, 3, 4, we need a health accord. 1, 2, 3, 4, we need a health accord. 1, 2, 3, 4, we need a health accord.
So what's happening here today?
Today we're here actually trying to bring a message and sound the alarm for the rest of Canadians so that they understand the significance and importance of the expiry of the health accord, which occurred last year on March 31st. The health accord is an agreement between the provinces and territories, and the federal government that sets up national standards, and it sets the rates for funding, healthcare funding by the federal government to the provinces. And so upon its expiry, we basically are left without any kind of federal leadership around the issues of healthcare. With no federal leadership, what we end up having is 10 separate jurisdictions that have no common thread, and your ability to receive healthcare will not be the same in each single province. And Canadians need to remember that Canada is one country. Our Medicare system is a Canadian Medicare system, and even though provinces have jurisdiction over their healthcare delivery, we still need to have national standards so that if people move from one province to the next, they will be able to receive the same timely and quality access to healthcare, to public healthcare, regardless of where they live and regardless of their ability to pay. And that was the value, that was the intent of our national healthcare system when it was actually instituted over 50 years ago.
So what do you hope to come out of this rally today?
We hope that not just this rally, but across the country, Canadians are standing up again for this, demanding that this government take a leadership role. We want them to hear us. This is a good time for them to have this public pressure put on them, given that there's a federal election coming up, and I think it's the right time to demand that they listen to Canadians and provide that federal leadership, regardless who's in power, provide that federal leadership so that Canadians have access to a quality public health care system, which is I think the core of our values. Today, across the country, Canadians are raising an alarm to the fact that the health accord expired a year ago, and we're no closer to having Prime Minister Harper join the table once again so that we can negotiate another health accord. The health accord is definitely a document that's needed, that will set national standards, that will ensure that every single Canadian will receive the type of health care across the country, regardless of where they live, based on the values and the universality of our public health care system. So it's a really timely event, given that there's an upcoming federal election. We want to make sure that sometimes politicians don't necessarily see the light, but they do feel the heat. So we hope that even gatherings like this will bring attention to the fact that Canadians are expecting leadership from their federal government when it comes to one of our most prized possessions, which is our healthcare system. So thank you so much for coming. Any amount of noise that we can make makes a difference, and I think we need to keep on fighting this year to ensure that healthcare is one of the most important things on the table during this upcoming federal election. So I'm just gonna.
And we have been seeing the federal government vacate its space with regard to healthcare for decades now. They started saying that our Medicare system should provide that they would put towards the Medicare system 50% of the cost, and now it's down to some paltry amount, I think it's under 20%. So by choking off the funding, they're actually bringing in the privateers, making it attractive for all sorts of privateers to take over our system. And I think we need to ensure that we tell the government that we expect our federal government to have its role, its leadership role in our healthcare system, whether that's for Medicare and or including pharmacare. Hopefully you've seen the recent report that says for $1 billion we could save $7 billion and cover every single prescription drug for every Canadian. So let's tell Rona Ambrose and Harper that they need to take their role seriously with regard to healthcare. Thank you.
Woo!